All right, now we talked about the pathophysiology of the heart in the part 1 of this cardiac series. And so that was the first thing we had to understand to go any further. We had to kind of recognize that without the whole anatomy and physiology piece, you can't understand this. So nursing schools and med schools and everywhere else, that is always part of the beginning of your program, the anatomy and physiology. Some of us didn't do too good, some of us did okay. But if you don't understand it, this will be difficult. So I may reflect back and forth on it, so don't worry, I'll try to catch you up. But so right now, we're going to go into some $4 words, okay? I call them $4 words. This ain't the way we normally talk with our folks, but when you're in nursing school or med school, you got to talk like you got some sense. So here we go. On the board, and you're going to see me underline many of these things because I'm underlining them hoping that the photographer gets a focus of what I'm underlining and can see what I'm doing. So here we go. That was a shout out to my boy Larry. So, STEMI and STEMI. You and I don't talk like that, right? MI history with PVCs. Acute coronary syndrome. Woo, that's a lot, ain't it? Well, you're going to be all right. Here we go. Let's get this party started. So, when a patient comes in and they are having what I would call an acute coronary syndrome. You already know acute means, uh-oh, just started right now, we're having some problems. When they come in with this acute coronary syndrome, they could be having chest pain, teeth, jaw, shoulder, and arm pain, especially on the left side, but not exclusively, so don't get yourself in a box and only focus on the left. I've seen it on the right. So they could be having chest pain. They may perceive it because it's right in here. They may say, my stomach hurts. They could say that there's pressure. Some mistake it for heartburn. At any rate, it may have actually followed a stressful situation. Or maybe it followed some physical activity. Maybe they were at the gym and they were working out, doing their thing, and all of a sudden they just feel like this pressure, this chest pain. Perhaps, uh-oh, y'all, hold on, wait a minute. Maybe they was bumping and grinding, y'all. Yeah. While you trying to swing off the chandelier and get your freak on, now your chest is over here hurting. Especially if you taken some of the purple diamonds, we call that Viagra, and you mixed it with a little nitro or did something crazy. But bottom line is, you were doing something right before this chest pain might have happened. Maybe you were doing what so many people do and end up with a heart attack. Maybe you were high risk for a heart attack in the first place and you were out there shoveling snow. Oh, that's a double whammy, because let me tell you something. Cold weather makes sure blood vessels get real narrow, and we call that vasoconstriction. And when your blood vessels get real narrow, and we call that vasoconstriction, blood can't really move through them the way it was moving before you got in that cold weather. And then you took your behind out there in that cold weather, and then you did some heavy lifting of snow, and that was exertion to the heart, because as you know, when you're doing some type of exertion, the heart needs more oxygen, and remember, it's cold and you done got those vessels closed up like this, so now you need more oxygen, but you closed off the pipes. Don't even make sense, does it? Okay, or maybe, look, listen, I got to say this because some of us are out of control. Maybe it was Thanksgiving dinner. Oh my God, did I say that? Did I go there? Now don't get it twisted. You still going to Thanksgiving dinner. You still gonna have that turkey and dressing. You still gonna have that macaroni and cheese with 4 cheeses and the burnt part around the edges. You still gonna have that peach cobbler. You still gonna have that fried corn if you come to my house, because I'm old school, I still fried corn. You still gonna have them candy yams. Oh, you gonna have all that. But here's the problem. If you are at risk for a heart attack, a big meal like Thanksgiving dinner, which is a very common time for patients that go in the hospital with chest pain, A big meal works your heart. Did you know while you're eating and digesting, it takes a lot of work on your heart to do all that? And then typically if you got up from eating this big meal and thought you'd go outside and shovel the driveway for your guests to be able to move their cars, now you got a double whammy for real. So big meal, cold weather, exertion, bumping and grinding, you know what I mean, sex, yeah, that. Okay, stress. Oh, no, I'm not talking about the typical stress we deal with every day. No, this is really horrible stress. This is you found out your mom died. This is you got served with divorce papers, because I've been married 22 times. I think it was 19 last time we were together, but it's just been some more stuff going on. So, divorce papers, maybe that was you. Maybe your dog died. Don't underestimate the dog, okay? I don't know what it was, but the bottom line is you are this person that is coming in with this chest pain. And when you come in with this chest pain, the nurses and the doctors, we've got to figure out what's going on. And there's really 3 things that might be going on. And those 3 things are, and let me just write them, or at least put a star by them. Maybe you're coming in with a classic heart attack. That's the MI patient, right? Myocardial infarction. Well, I got a news flash for you. We don't say myocardial infarction and leave it there. No. We do things like call this a STEMI. Are you with your girl? ST elevated MI. You can't just say MI nowadays. You know more than we knew back in the day. We have to define what kind of MI is it. So let's go with our traditional MI. You have a handout about this. If you think about the traditional MI, the patient comes in with that jaw pain, that chest pain, maybe their back hurts, perhaps they think it's their stomach hurting. They come in exhausted, they are sweating, and I done told you before, if somebody shows up at your facility sweating, it is a medical emergency, because something real acute is going on. Maybe it's their left arm and the shoulder, perhaps it's the right side, who knows, but they're coming in with these complaints, and you need to think this could be an MI. So if this patient is going through all of this and you believe in your spirit and your heart it's an MI, if you didn't already call 911 because you're at a facility that's not a hospital, then you should have. And if you did work in a hospital setting, well, then you got to kick into action, because you only have a few minutes to get this right. Did I mention it? Minutes is muscle. What kind of muscle? Heart muscle. You waste minutes, this heart muscle dies. So what are we talking about? Well, as soon as the patient arrives, we want to give them aspirin. Yeah, just regular old aspirin, the old stuff back in the day. Aspirin. Now, what kind of aspirin? Well, it can't be enteric coated. It's got to be the kind you chew, and this aspirin is 325 milligrams. You better know that. Did I mention it's 325 milligrams? Yeah. The aspirin is 325 milligrams. You give it to the patient to chew. They are putting an EKG on this patient at the time. There has to be aspirin on arrival, and that 12-lead EKG better be on that patient and read it out within 10 minutes. Did I mention minutes is muscle? Did I say it? Did you hear it? Do you get it? Do you understand it? Good, because you got exactly 10 minutes to get this right. Now, you're looking at your EKG. While this EKG is being put on the patient, somebody else is getting an IV line in them and drawing some labs. We're looking for troponins, ain't that right? That's right. So we got what? 325 of aspirin, 12-lead EKG within 10 minutes. Then we are working on what did the EKG show, and if it's showing you an ST elevation on the EKG, then we know we have a traditional MI, and now our focus is getting you as fast as we can to the cath lab. You got to get to the cath lab. Now, I'm not going to brag, but I do happen to work at one of the #1 heart centers in the world. And the heart center that I work for gets their patients to the cath lab within an hour. But you got 90 minutes. Truth be told, you got 90 minutes to get this patient to the cath lab and into a situation where they can get their blockage fixed. Now, if the EKG does not show an ST elevation, and you got to remember the labs that you drew, because while the 12-lead EKG was being put on the patient, we were starting at IV and drawing labs at the same time. And of course, we were looking for cardiac markers, particularly troponins, because within about 2-3 hours, those go real high. And of course, we repeatedly order them. We go every 6 hours or so to see what they're doing over time. But we don't have a lot of time, but we did check our troponins. But you see, when we checked our troponins, they may or may not be back yet. So the ST elevation is enough for us to get this patient on over to the cath lab, because they came in symptomatic. You remember that, right? Now, the pain that they're feeling, we said we had 90 minutes to get them to the cath lab. So what do? Do we pull up a chair and sit down and chill with Dunkin' Donuts and eat some donuts and drink some coffee? No, fool, you doing a whole lot waiting on this cath lab. You don't wait, you get things ready. But how do we get a catheter if we are having a patient come in with these symptoms? How do we get a catheter in the patient without preparing the patient, right? So in between all this time you're waiting or preparing, because you're not really waiting, you're never waiting. Time is muscle, muscle is heart. Okay, so what we're doing is we're making sure we put the IV in the patient. We're making sure that we weigh the patient. Why are we weighing this patient? The weight. Why are you weighing people? People don't like you to weigh them. They don't like that at all, especially women. No, you're weighing the patient because you got to get prepared for the catheter. To get prepared for a cardiac cath, we're going to need some heparin. You can't get heparin unless you got a patient weight. So you got the patient's weight. You also are giving nitro. Most patients will get nitro so that we can kind of cut down on this vasoconstriction. Now don't forget your basics. Nitro is a vasodilator. It's going to open up the vessel, get more blood to the heart, and hopefully save the tissue, right? That's what we're trying to do. So let's do a recap. Came in with chest pain, consistent with an MI, sweating, pressure in the chest, the whole thing, maybe even completely total risk factors like smoking. The patient has let's say a fluffy body, obesity, BMI greater than 30, whatever it is, you know that this is looking like an MI. Okay, so the patient comes in, we gave him the 325 of aspirin, we went on ahead and put the EKG 12 lead on them. We were doing IVs and drawing blood at the same time, knowing it's going to take a minute to get the troponins back. We were also making sure at the time that we got nitro ready, because we know nitro vasodilates. And if you told me your pain level with this chest pain you came in complaining with was around a 6 or maybe a 9 or perhaps an 8, I need it to be 0. So I can titrate my nitro up as your pain goes down. I'm good, because if you tell me your pain is 10, we're going up. If it's still 8, we're going up. If it's still 6, we're going up. If it's 0, cool. Okay, so guess what, y'all? I know, I'm old, I get it, I done been around a long time, and some of you have too. And so you're saying to yourself, well, Shelly, all you had to do was say Mona. I mean, if the patient's coming in with a heart attack, just call it Mona. Just treat the patient with Mona. No, honey, that's not what we do anymore. No Mona. So if you're listening to a video and it's talking about Mona, lies, baby, lies. We don't do Mona no more. We don't do morphine. And we only do oxygen if the pulse ox is less than 90. You see, it's called evidence-based medicine. If you give oxygen, what did you give it for? Was there a need for it? Was there hypoxia? If there isn't, then what are you doing? So you got to roll with me on that, because a lot of people still teach Mona, and it's just wrong. And you know what? Your tests, they're not old-fashioned and outdated. They're going to be based on the newest information out there. All right, so you got it.